Menopause has come up a couple
Oh,
times.
yeah.
Women going through that stage of life.
Yep.
Hormones are changing.
Yep.
Any specific strategies for them falling asleep and staying asleep?
Yes. So to be clear, we would need an entire podcast just to talk about this. Like, I want to be clear, like, there's no way I can do this topic justice in a small time period, but I think I can give people a general idea set of things to think about. Okay. So, number one, for all the people out there that are dealing with menopause, one of the things we know is that specifically for women, the ratio of having sleep apnea doubles for women when they hit menopause. So, if you start snoring during menopause, if you gain weight during menopause, if you have difficulty sleeping and wake up multiple times during menopause, you need a sleep test. I know you don't think you have sleep apnea, you might. Go ahead and get a sleep test. We want your breathing to be consistent, especially when you're sleeping during these crazy hormonal timeframes. So, step number one for a lot of women is go ahead and get your sleep study done to make sure if you've got apnea, you treat it. If you don't have apnea, then you don't have to worry about it. So, step number one is that. Step number two is you want to regularize your sleep schedule. Okay. You can't, I get it. It's hard to figure out when to go to bed and when to wake up. Then make your wake up time consistent and then go to bed when you're tired, right? But having a consistent schedule is important because menopause itself will try to throw your schedule off. Number three, caffeine sensitivity increases. So what you used to be able to do was have coffee at 2 o'clock in the afternoon and have it not affect your sleep. When you hit menopause, guess what? You need to probably stop caffeine by 11 o'clock in the morning. And by the way, alcohol is the same way. And this really sucks because a lot of women think, oh, I feel miserable. You know what? I'm stressed out from all these hormonal changes. I'm just going to have a glass of wine and relax. Alcohol hits differently when you're 25 versus 55, and it really affects deep sleep. So I would say get your airway checked and make sure your breathing is okay. Avoid caffeine late in the day, regularize your sleep schedule, avoid alcohol late in the day are three general recommendations. And also, if I'm being super honest, consider hormone replacement therapy. There is a lot of good data to show that when you get on progesterone, you sleep better. We did a real disservice to women for many, many years. There was a group of people who said that HRT therapy, hormone replacement therapy, could cause cancer, and the data on that is not consistent. We've now done a real disservice to a whole generation of women, telling them that they can't do HRT therapy. Talk with your doctor. HRT therapy is much safer than anybody ever thought that it was, and that is a surefire way to get yourself to sleep a whole lot better during this menopausal transition.
All right, another stage of life variable, kids.
Yep.
Somebody who has young kids and inevitably their sleep patterns are going to change. They're going to be waking up to take care of them during the night.
Mm-hmm.
We've gone over the importance of sleep to this point. So somebody who is now stressing because
Right.
they want to get that deep sleep and get quality sleep and now they can't, what would you say to them?
What I tell people to do is sleep in shifts, right? So doctors are on call all the time, right? And we still make it through the night. Why? Because we don't stay up every single night being on call. So if you have a partner, then you can do this. Monday, Wednesday, Friday, you handle the child if they wake up in the middle of the night. Tuesday, Thursday, Saturday, your partner handles the child in the middle of the night. And Sundays, you flip a coin or you alternate whoever gets it. That way, every other night, you'll still get a reasonable night of sleep. And you know that you're not going to get disrupted because your partner has already agreed that they're going to handle child in the middle of the night. Now, one thing people might turn to me and say is, well, what if my child is still breastfeeding and I'm not the breastfeeding participant in this relationship? How does something like that work? So what you'll want to do is you'll want to have your partner pump, so that way you can actually have breast milk available. But here's the trick. You want them to pump in the evening time. Most people don't know this, but breast milk produced at night has melatonin in it, and breast milk produced during the daytime does not. So you want to label the breast pumped milk AM versus PM, and then whoever's coming in the PM be able to grab the PM stuff and be able to help out.
Since you made it to the end of this clip, I know you're going to love the full episode. Click here to watch. I'll see you over there.
What do I do when I wake up at 3 o'clock in the morning and I can't go back to bed? By the way, is kind of the number one problem that people ask me about. This is exactly the protocol that I use with my patients. So every human on earth